According to Healthcare Without Harm, U.S. hospitals generate more than 2 million tons of medical waste each year. Much of that waste is unused medical supplies and equipment. Meanwhile, World Health Organization estimates in developing countries that more than 10 million children under the age of 5 die due to inadequate medical care. For this year's annual Global Service Project, Hands Across the Water, Roper St. Francis Healthcare will be raising money to fund the shipping of a 40-foot container of much-needed medical supplies and equipment to our friends at Plateau Mission Hospital in Kenya, Africa. To do this, we will be partnering with MedShare. MedShare is a nonprofit company based in Atlanta that collects surplus medical supplies and equipment from hospitals, medical distribution companies, and individuals, and then redistributes them to qualified healthcare facilities in the developing world. As you may recall, in early 2009, Roper St. Francis employees, physicians, and volunteers raised more than $35,000 to provide a safe water system for the Plateau Mission Hospital, Plateau Primary School, and Plateau Community in Kenya. As a result, the Plateau Community now receives an average of 5,000 liters a day of clean water for drinking, bathing, and cleaning from a sustainable source. The hospital, which no longer has to pay for pre-treated water, has seen the rate of waterborne illnesses drop dramatically, while absenteeism at the primary school has fallen as well. For our Hands Across the Water project, Roper St. Francis Healthcare will refocus its efforts on Kenya with the goal of shipping approximately $150,000 of refurbished medical equipment and supplies to the Plateau Mission Hospital. With your help, we can once again make a huge difference in the health and care of our friends living in the Plateau community. Once we have raised the money for shipping the container, Plateau Mission Hospital officials will work with MedShare to select the equipment, ensuring that donations meet the hospital's needs and goals. The medical supplies that will be available to the Plateau Mission Hospital include masks, gloves, sutures, syringes, surgical instruments, surgical drapes, IV sets, dressings, and hundreds of other items. Medical equipment available may include hospital beds, anesthesia machines, ultrasound units, and examination tables. While Plateau Mission Hospital continues to have a variety of critical needs, it also has capable professionals, strong leadership, and thoughtful goals and plans for improvement. They will certainly benefit from the supplies and equipment, which will help aid in their poor conditions and lack of supplies. Our fundraising goal for Hands Across the Water is $25,000. That includes the cost of shipping the container from the U.S. to the Mombasa port in Kenya, Africa, and the cost of ground transportation from the Mombasa port to Plateau Mission Hospital. This is approximately 7,800 miles, but just $1 can pay for the container to move 3.2 miles. So if each of us just gives $5, we'll meet our goal. All donations are tax deductible, and you can donate through a fundraising website that is available on Careline and on our Roper St. Francis Healthcare Facebook page. You can also donate through our pastoral care departments at Roper, St. Francis, and Mount Pleasant hospitals.
Scott Broom reading a letter from Mr. Jarius Searseer, administrator at Plateau Mission Hospital in Kenya. Dear Scott and our friends at Roper St. Francis, we want to thank you for considering us in your upcoming global service project and working very hard to raise some funds to support the shipment of machines, equipment, and medical supplies through MedShare. If we are blessed with such equipment, it will bring a lot of positive impact to our hospital. We shall be able to provide the services in the rural area, where most of the facilities do not provide such services, and thus all patients will be able to receive services they are seeking right here at Plateau Mission Hospital. This will change the face of the hospital completely, and we will imagine that we shall become a referral facility in the rural area because we shall provide unique services that patients cannot get elsewhere in the rural environment. Please pass our greetings and blessings to all there. Jairus Sincere.
Thank you in advance for your continued support of the Roper St. Francis Healthcare Mission, healing all people with compassion, faith, and excellence, and Plateau Mission Hospital.